Pharmacists, also Commonwealth English, or druggists, North American and, archaically, Commonwealth English, are health professionals who control, formulate, preserve and dispense medications and provide advice and counseling on how medicines should be used to achieve maximum benefit, minimal side effects and to avoid drug interactions. They also serve as primary care providers in the community. Pharmacists undergo university or graduate level education to understand the biochemical mechanisms and actions of drugs, drug uses, therapeutic roles, side effects, potential drug interactions, and monitoring parameters. This is mated to anatomy, physiology, and pathophysiology. Pharmacists interpret and communicate this specialized knowledge to patients, physicians, and other healthcare providers. Among other licensing requirements, different countries require pharmacists to hold either a Bachelor of Pharmacy, Master of Pharmacy, or Doctor of Pharmacy degree. The most common pharmacist positions are that of a community pharmacist, also referred to as a retail pharmacist, first-line pharmacist or dispensing chemist, or a hospital pharmacist, where they instruct and counsel on the proper use and adverse effects of medically prescribed drugs and medicines. In most countries, the profession is subject to professional regulation. Depending on the legal scope of practice, pharmacists may contribute to prescribing, also referred to as pharmacist prescriber, and administering certain medications, for example, immunizations, in some jurisdictions. Pharmacists may also practice in a variety of other settings, including industry, wholesaling, research, academia, formulary management, military, and government. Historically, the fundamental role of pharmacists as a healthcare practitioner was to check and distribute drugs to doctors for medication that had been prescribed to patients. In more modern times, pharmacists advise patients and healthcare providers on the selection, dosages, interactions, and side effects of medications, and act as a learned intermediary between a prescriber and a patient. Pharmacists monitor the health and progress of patients to ensure the safe and effective use of medication. Pharmacists may practice compounding. However, many medicines are now produced by pharmaceutical companies in a standard dosage and drug delivery form. In some jurisdictions, pharmacists have prescriptive authority to either independently prescribe under their own authority or in collaboration with a primary care physician through an agreed-upon protocol called a collaborative practice agreement. Increased numbers of drug therapies, aging but more knowledgeable and demanding populations, and deficiencies in other areas of the healthcare system seem to be driving increased demand for the clinical counseling skills of the pharmacist.